So, hello viewers, welcome to yet another session of Face to Face with Toppers. We have with us Dr. Krishna Mohan, who is one of the toppers of Sreechithra. So I wholeheartedly congratulate him for his success.
And
Okay.
thank you for all your inspiration. I have done my MBBS and MD both from Rangaraya Medical College, Kakinada. After that, I moved to my hometown, Visakhapatnam. There I was working as senior resident in Andhra Medical College. From the days of MBBS, always medicine has been one of my favorite subject. And among the medical branches, cardiology and neurology has always eluded me. So among all the medical branches, whatever we name, still neurology is one where the clinical decision of ours is more important than the investigative workup.
Yes.
So that touch and also the variety of diseases and neurology is fast growing these days with many new therapies.
Exactly, Krishna. Whatever you said is true. Actually, previously it was thought that neurology is not just a armchair specialty, but now it has gone into lots of interventions are there, lots of new treatments are there. So previously cardiology was the glamour specialty, but now I think neurology is taking over because everything is there. We can learn, we can teach. We can do something for the patients also, not like the previous times. So how did it all start? Did you start preparing from your MD days or later after you finished?
Because initially after finishing my MD, I was in a dilemma whether to do DM or not also because I was in, I love, though I love neurology, but I am more interested in general medicine also at that point of time. So I was taking some time to see how I will feel about neurology. So in the first attempt I have written, I passed my MD in 2019 May,
Okay.
and I have attempted the NEET that session and I got 270 rank.
Oh, okay. Very good.
Then I thought, no, I want to get into National Institute AIMS, and then I attempted the AIMS exam, and I went for interview also the session AIMS.
Okay, last
and
year.
I got JIPMER last year. I got JIPMER 6th rank last year.
Oh,
I went for the counseling to that time.
Okay.
Then again, JIPMER, I couldn't get the seat last time also. So again, I prepared for the next session.
Okay.
And the next session too, I went for AIMS interview. In the both sessions, I did not get AIMS New Delhi. I got chance to for AIMS Bhubaneswar or AIMS Rishikesh, which I was not interested at that time.
Okay.
Then the COVID pandemic started and all. For financial reasons, I had to work outside, and I was working in a hospital. And later, again, I gave NEET. I got 152 rank in this time because of this COVID and all. I was unable to do proper reading.
Okay.
At that time in Visakhapatnam, there was a strong wave. I was working outside, so I couldn't completely concentrate. So after the NEET was over, then again, I was thinking I want to my aim is to get into institute. So again, I started reading. With God's grace and with help of all yours, I could get into Sreechithra this time.
So during your preparation, which institute was in your top list?
AIMS Delhi was my passion since MBBS days, though I couldn't get at MD level 2. But when I was doing my MD, my assistant professor in neurology, he always told me that I should be doing my DM at Sreechithra. He has done in Vizag only, but he worked here for a few months while he was doing DM. So he was inspired with Sreechithra. He told that I should be doing there because the education here is so he saw an enhanced AIMS and Sreechithra, but he liked Sreechithra more. So he always told me that I should get into Sreechithra. But last year I have attended Sreechithra. I couldn't even clear the first step of MCQs too. Okay. So I thought maybe okay, Sreechithra is not my cup of tea. I should be trying for more AIMS because the pattern of AIMS exam is different. So I thought I'll be have more chance to get into AIMS.
Okay. So you said that AIMS pattern is different, Sreechithra pattern is different. So what difference actually did you feel in these two exams? Because both have got theory, both have got interviews.
Till the last session, the Sreechithra pattern was, the practical pattern was different. Though this time they had conducted an online interview, the practical pattern was different at that time. And second thing is that regarding the MCQs, Sreechithra is also having general medicine MCQs, where AIMS, we can only concentrate with the neurology part is enough. And what I felt regarding the AIMS neurology paper, if you will be thorough with Harrison each and every word, we can get completely through the paper of the AIMS.
Okay.
Though we may not get 80 out of 80, but we will be getting minimum of 65 marks definitely if you'll be thorough with the part of the Harrison, only the neuro part of the Harrison. Most of them, even if we can logically exclude few more questions, up to 72 we can 70 questions we can get only from the Harrison. That is what I felt.
Okay.
And the AIMS question paper, what I also observed is that they all every time they concentrate upon the stroke trials and the stroke guidelines. So if you read the stroke guidelines, the Harrison part and the epilepsy part in Bradley, these three will only these three can get you up to 70 marks in AIMS. That is what I felt. Sreechithra paper, so it is more of basics. They were testing more of basic both in general medicine as well as neurology. They were touching very basic points in Sreechithra exam.
So from what
so this time the interview of both the exams were like similarly they have asked for case scenarios. This time I can tell particular areas where we can see like stroke is one area. The second is the drugs of Parkinsonism and multiple sclerosis.
Okay.
And third one is the muscle disorders, especially the muscular dystrophies. So these areas are more being concentrated in AIMS. For last 3 sessions, I have observed this pattern. Though this time, again, they're more concentrated on dystonias is one of the movement disorders have been the highlight of this session actually.
Okay. And Sreechithra is different because they ask the basic questions. So I think they are going more in neurophysiology, neuroanatomy, neuropharmacology.
Yeah,
and
exactly.
Coming to
Exactly.
part of neurology. What do you think were your mistakes during that time, or what you should have done at that time itself that you would have joined 1 year back, 1 year earlier? You must have.
I thought during the first time I have gone through all these exams, I think I lacked the determination at that time. I lacked the determination at the time. First thing. Second thing is my revision should have been more thorough. So these two are the things I thought. At the time I was thinking, okay, these are institutes. It's maybe difficult task for me to get into them. So I was only just writing an exam like an attempt rather than with a serious motivation to go. I mean, I was not confident enough to get into that institute at that time.
How you overcame all this negativity?
So I had attempted these exams and I got good ranks like JIPMER 6th, and I went to the AIMS interview and all. So I got confidence. Okay, I am not subpar. I am par with people who are getting into AIMS or JIPMER or somewhere. So I should be more persistent. So that is what I have done. I have been persistent with my effort. I was doing regularly, doing my revision and reading all the topics of the importance. So I think that that has got me through. And as I told, again, I have given this NEET also because of my, again, lack of preparation. I got 152 rank in NEET. I was a little disappointed. Again, I motivated myself, and your messages in the group also motivated me at that time. You have given some motivational message, and also you encouraged us to read by giving some short topics to read. So again, I attempted the exams, and then again I got confidence. Okay, I can, though the time is less from NEET to the institutes, again I can make a difference. So again I started reading, and I could do this time.
Okay. So I think most of the aspirants at some point of time may need some kind of motivation to just go on and keep working till they reach the aim. I think this time NEET had a very bad impact on the total mental status of all those who are preparing. So I get that. That's why I sent all these motivational messages. So I knew that actually so many exams are there. After NEET, I didn't know this much exams are there because there were 2 NIMHANS, 1 AIMS, 1 PGA, 1 JIPMER, 1 Sreechithra. So that is, I think, more than 30 seats. More than 30 seats are there for those who couldn't clear the NEET exam, those who couldn't get the good ranks in the NEET exam. So, but people fail to realize that. They think that these institutes are there, not, as you said, not your cup of tea or out of my league. That's what they think. But I think as you did, it's last year itself, you started attempting. So every attempt counts, especially.
Definitely, sir. Every attempt counts because we will know the pattern of the exam. That is more important, where to concentrate, and we will know what are our lackings once we attempt the exam. Sincerely, whether it's a practice test or a real test, we should be attempting the exam. That is the most important thing.
So those who are viewing this video right now, I will emphasize the point that next time, that is 2021, don't even think that you don't even miss any single exam. As such, you should attempt. Okay, preparation part we'll see later, but you should now itself have in your mind that apart from NEET, you will attempt every exam you would be able to. And I think most of the exams are now online. You needn't travel that much for writing the
Yeah.
exam. So it's just maybe a few distance nearby your centers. The exam they will keep the exam center.
Yes.
Okay, Krishna, that is a very valid point. I think you emphasized that. So I think all the viewers will follow this after listening to your advice. And
Uh,
uh, tell me,
I
Krishna.
would like to tell one more thing, sir.
Yes.
Your effort towards the benefit of all the students, that is commendable, because nobody will be taking their time of their busy schedule and do this for no reason except for satisfaction of teaching. So
Yes.
that is what also inspired me. Like, see, somebody is trying to support us, so I should put my effort too.
Okay.
So that also drove me, and your exams have been helpful for me. I was working last 5 months. I was working during the COVID outside. So
Okay.
after completion of my work, I come home and regularly I'll be having some test of yours to be yours to be there. So I'll be going to the topic and then do the bits and again revise the topic. That had helped me very much. Though all of your tests have helped me very much.
Oh,
Thank you very much, sir.
welcome, Krishna. So the thing is that okay. So what do you think? Like during your preparation, you have studied last year itself. You have studied. So what should the ideal strategy be if you are like you have finished your MD just 1 year back? So 1 year gap has come between your teaching because studying actually because you were actually working in between, and the COVID times would have been hectic on you. So how did you manage your time? And when did you actually did you go for any coaching, or did you directly studied and after that just attempted the mock exams we had conducted? What was your plan?
I haven't gone for any coaching. Only most of the times I read Harrison only, and some of my notes which are written in during my MD times. See, my kind of preparation, I used to always read daily 2 to 3 hours. That's it. So
Okay.
consistently 2 to 3 hours a day,
Okay.
not more, not less. So daily. So that was my schedule like that.
So at least you should, if you are even working, I think everyone should spend at least 2 to 3 hours consistently every day, so that they get success in the exams. So that was regarding the studying, but I wanted to know more about the this solving questions part from your side. That mock exams, module clear and all. Uh, where like did you plan it or do, or because it was there you just completed the mock exams and all? And what do you think
Because
that what do you think actually the juniors or next aspiring people should actually do?
actually, to be frank, I have attended all the exams of yours because they're available to me. I came to know because of these exams. A group is there. Somebody, one of my friend has joined me to the group. So in that way, I came to know about the group, and I have done all the tests. Um, so my kind of preparation, even from MBBS or MD days, I used to do the MCQs less, but I used to do some few tests just because before the examination, rather than doing MCQ books and all. So
Okay.
I think doing few good tests before the examination will help us guide through the examination strategy rather than doing many MCQs.
Okay.
Instead of doing many MCQs, I feel read the text thoroughly and understand the concept, and so that will help you more with the solving of the questions, because not all the questions are memory based. Many of the questions require our thought process to be there. So I
Yes.
felt so like that.
Yes, truly, Krishna. Actually, that's a good thing you have said, because many questions in NEET as well as any institutes will be clinical approach questions, because they are all these are actually questions prepared by clinicians, basically neurologists, and not even physicians as such, but maybe neurologists only would be putting the questions. And it is not more of a memory based questions, but they will look into some aspects like whether you are updated. So that is why institute questions will be asking updated parts, that is newer drugs, newer trials, etc., and whether you know the basics. That I think can be fully covered with Harrison. And cracking the MCQs, if you do lots of mock exam, at least after getting thorough with all the Harrison and some Bradley part, I think mock exams would be more than enough. But some people may
Yes.
need coaching if they think they need a.
Yeah, I was even watching your fine videos of stroke, the last two videos you made. When I watched them, those two videos too, so very informative, sir. Definitely, coaching of a good teacher is always helpful. But at the time, I didn't have time for coaching. I was working, and when I found this opportunity of this mock test, I thought I should utilize them, and I made use of them.
Yes, yes. So that is a thing. And what books did you think? Do you think that the next coming PG aspirants should have with them for sure? So if you like limit to a few books, which all books? Harrison, I get it. After that, Bradley should we have?
Yes, yes. Bradley should have Bradley, and we should read few topics from Bradley definitely.
Okay.
I suggest to read Epilepsy Compulsory from Bradley.
Okay.
And Dizong is one book which I read during my MD days, so helped me a lot with many of the clinical questions that we can get, and many of even some exams have asked some science, and it helps us put our the theoretical knowledge into perspective for a diagnosis of a case scenario.
Yeah, they give
that is
scenario with clinical science and all, and if you are thorough with your clinical part with the help of Dijon, you think that it will help in clearing the exams, especially scenario questions and all. It will help. Okay. Okay. So I think and regarding your Sreechithra journey, Sreechithra theory, last time you had attempted, you couldn't break through. This time, after getting the results, what was your feeling actually after getting Sreechithra? You are thrilled or confused or worried? What is next?
I was after completing the examination, I was confused. After seeing the result, I was shocked myself. I was even thinking, okay, I've not done my part good in the examination. I should be preparing for AIMS. The next coming examination was my thought after finishing the examination. Okay. But as soon as I saw the result, I was shocked myself with the result. And then later we have come into the group along with Krishnamurthy sir's questions and all. So those scenarios, I was constantly going through all these scenarios. So that helped me with the interview. So in the interviews, what I thought is that they will be asking mostly the common presentations of the common diseases or approach to the case rather than individual points and all. They were looking at our overall approach to the case, a common presentation, a patient coming with stroke, a patient coming with symptoms of Parkinson's or with a muscle disease. So they are giving a case scenario and they're asking how we approach the case.
So what were your cases in Sreechithra? For the benefit of Sreechithra aspirants, not the cases I am asking, interview part, a few questions to get a hint of what they are asking. Maybe next year what they will get.
They asked me about the differences between the NMO and multiple sclerosis. How do I differentiate them? And they have asked. They were given a case scenario of a stroke patient, and they asked me how do I approach in step by step a scenario of status epilepticus, and also they asked me the doses of the status various drugs in the status epilepticus drug doses. They have asked me, and they have asked me the COVID manifestation, neurological manifestations of COVID.
COVID.
These were the questions.
And what do you think? AIMS. You attend the interview, right? AIMS also. AIMS. I think you have tried 3 times. So we are well versed with what the interview would be like. So, what suggestion would you give for AIMS aspirant next year regarding the interview preparation?
So even AIMS interview too. The first time I went there, they were asking me. So they told me a patient came to you with complaint of proximal muscle weakness. So what will be your differential diagnosis and how do you approach to them? So they have given a scenario of stroke, and again there they have asked about the neuropathy case and a case of Parkinson. How do I treat a case of Parkinson? That was during my first interview. The second interview, they had given me a scenario about transverse myelitis case. So they asked me how do I investigate the transverse myelitis? How do I what are the differential diagnosis and what clinical signs I look for in the case of this transverse myelitis? Where do I localize this case? That was the question they have asked me. And they asked me both in AIMS and Sreechithra, they asked me one question, that is, how do I approach to a case of monoocular blindness? The question I got in both interviews.
Okay. Okay.
And one more question I got is they have showed me a case of with patient with the carbamazepine rash,
Okay.
Steven Johnson syndrome, and they asked me what are the other drugs that can cause this rash, and how do I manage, and all. These were the questions I got. So this time AIMS, I don't know, because number of students they had, they asked only one question we got for each person. And the question I got was about posterior ischemic optic neuropathy.
Okay. PION. Okay. Okay. So from what you told, I get it that institutes during their interviews are concentrating especially very hot topics like stroke, epilepsy, movement disorder, or maybe some parts like visual loss, monocular visual loss, etc. And maybe
Most
also
of
more
emergencies. The
Parkinson's.
emergencies. How do you approach a case of coma?
Okay.
How do I approach a case of stroke? How do I approach a case of status epilepticus? How do
Yes.
I approach a case of meningitis?
Okay.
How do I approach a case of Parkinson disease?
Yes. 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 And I think demyelination also came into picture. I think you have made it easy
Definitely,
for. Yeah, you have made it easy for next year interviewers by telling all the hot topics. Actually, you have pointed out each and every one. During your Sreechithra, in between Sreechithra preparation, you like interview where like you are comfortable with the interview because you have attended AIMS. You are very much comfortable with the interview, or are you afraid still of the interview pattern? Because many of the exam aspirants are a bit afraid of the interview. So, how do you think can you become more comfortable in interview? Do we need to really do something to improve the interview part?
The first time I went to the interview, I was I was shocked. I mean, looking at all the professors there and the faculty there. I was the single person sitting there, and 9 people were sitting there in the examination, the first AIMS interview. So first question, I was really confused. What is going on here? I
Yeah.
am been actually intimidated by all these people sitting there. Can I even speak before all these big people and all?
Yeah.
But so slowly, what I thought is, okay, they're asking simple questions. On my part, I should be confident enough. So it's like regular our Viva exam for an MBBS or MD. What we go with a final examination, how we approach our external, the same thing that should be done and kept in mind, nothing else. So if even if we answered one question wrong, be confident about the next question. If that we may answer right, and we can do the interview. You can get through the interview comfortably.
Okay, that is to
Because
be.
all of the MD graduates, they'll be doing their external examination with professors whom we do not know.
Yeah,
So
yeah.
we'll be answering external Viva. So it's similar to that only, nothing more.
Okay. So the interview part you were comfortable, and you were. I think from what you said, it's better to have mock interviews or like get trained for interviews before attending. Maybe your first interview. I think you should get trained so that it becomes
Yes.
easy and you may have a high chance of cracking in the institutes. So I think you were more concentrating on the institute exam rather than NEET.
Yes,
And
sir.
so NEET, any advice for the people actually, and other than reading Harrison, any advice as such you have?
NEET, what the last 2 exams, especially this year's exam, I found the pediatric neurology part is more appealing. More of the questions coming from pediatric neurology. So, like most of the physicians attempting the examination, during our MD training, most of us will not be looking much into the pediatrics part, neuro part that too. So that will be we need proper reading of the pediatric neurology part, especially the developmental defects and the epilepsy syndromes. Anyhow, we'll be reading even as an physician, we'll be reading about the epilepsy syndromes, but the more of the developmental disorders, the metabolic defects. So these are the things which we usually do not read during the MD course. So we should be more thorough with those enzyme defects and the genes and all of the pediatric diseases.
Okay, pediatric
Even
neurology.
the last need too, I remember getting many MRIs of pediatric neurology disorders. Many at that time I even do not know many of them. After coming home, I again started reading the pediatric neuro part.
Yeah, as you said, actually, pediatric neurology is well useful or is an integral part of neurology. because we
Yes.
don't have so much of pediatric neurologists in our country. It is actually a part of
Yeah.
neurology, at least for 10 years
Neurology.
from now. So you have to learn
Yes.
it for definitely, and you will be learning in after you enter Chitra or after you enter your DM course as such.
PM.
But and since these neurologists are the ones who are preparing these questions, and also that the number of the pediatric neurology seats have slowly increased from the previous, the big increase is there. They want to incorporate that people also, pediatricians also to
Yeah.
this thing. So they will be putting more questions, and I expect the trend to remain at least the same like this year. This much of pediatric questions this year, or may increase, not decrease. That's what I feel. And I
Definitely. Definitely.
and as you said,
Definitely.
since it is an untouched part in the MD curriculum as a physician or MD PG, I think we have to emphasize more on that. Okay, we'll find ways to
Yeah.
crack into the pediatric neurology in our further
Definitely.
coaching. Yeah, I'm planning to make it in an organized way. So now we are just giving motivational messages, doing lots of mocks. I think the teaching part I have started, so I think we'll do it in an organized way through an app. I think that will help everyone. Okay.
Yes, definitely. Definitely.
Okay, so Krishna, so summing up, uh, can you just give some, not advice actually, can you give something to tell, something they can have in their mind always, this, all those who are like, especially Sreechithra aspirants, and even not even Sreechithra, even NEET aspirants, they will be preparing for NEET. I think all should aim for NEET, then they can step up the preparation once you have finished the basics, can think of solving Sreechithra questions and all at this point of time. So we have 8 months to the next exam. So you're beginning your reading, your new year, you are going to take a resolution of getting into some institution. So at this point, I think NEET should be your first aim. Then you plan for institute exams based on your acquiring of the concepts and knowledge. Those who couldn't get the college of their choice and are planning to prepare for next year, don't be disheartened. Just pick yourself up from where you have left and try your level best so that next time I think I will be able to give a face-to-face interview with you in place of Krishna. So with that, I think we'll wind up the session. I wish Krishna Mohan all the best, all the aspirants, that you should also start studies from today itself. Don't keep it for tomorrow or procrastinate things. You whatever time you get, you spend maximum. And even if you take multiple attempts, like what Krishna said, you should never feel that okay, first time I didn't get, or after seeing the Sreechithra questions you may think that it's out of league or not my cup of tea. So that shouldn't be your attitude. You think that you will definitely crack Sreechithra and enhance aims. And moreover, the NEET exam should be your basic exam, which you should always have in your mind while starting your preparation. And so with that, I thank Krishna Mohan for helping me out, for motivating the younger generation. And thank you all for your patient viewing.